Hello everyone, welcome to KAPS Recalls discussion. So let's start with today's first question. Question number 81. An example of pure narcotic antagonist is. The options are naloxone, pentazocine, nalbuphine, methadone. So here the correct answer is option A, that is naloxone. Naloxone exerts no narcotic effects of its own. This property permits naloxone to be used to reverse narcotic-induced respiratory depression without subjecting the patient to undesirable side effects. Okay, next question. Tumor lysis syndrome causes which of the following conditions? The options are hypokalemia, hyperkalemia, hypophosphatemia, hypercalcemia. So here the correct answer is option B, that is hyperkalemia. Now let's see how this option came as the answer. So first of all, what is this tumor lysis syndrome? Tumor lysis syndrome is an oncologic emergency that is caused by massive tumor cell lysis with the release of large amounts of potassium, phosphate and nucleic acids into the systemic circulation, which overwhelms normal homeostatic mechanisms, resulting in hyperuricemia, hyperphosphatemia, hyperkalemia and or hypocalcemia. So TLS is associated with the conditions such as hyperuricemia, hyperphosphatemia, hyperkalemia and or hypocalcemia. The pathophysiological manifestations of TLS can lead to acute kidney injury, cardiac arrhythmias, seizures and neurovascular dysfunction, which can cause considerable morbidity and in some cases death. So among these options, hypokalemia, hypophosphatemia and hypercalcemia are not associated with the TLS. So here the correct answer is option B, that is hyperkalemia, which means increased level of potassium. Question number 83. Which artery is widely used to check the pulse? The options are temporal artery, popliteal artery, radial artery, brachial artery. So here the correct answer is option C, that is radial artery. The radial artery is most commonly used to check the pulse. Several fingers are placed on the artery close to the wrist joint. More than one fingertip is preferable because of the large sensitive surface available to feel the pulse wave. The pulse points are the neck, that is the carotid artery, the wrist, which is the radial artery, behind the knee, which is popliteal artery, in the groin region it is femoral artery, inside the elbow it is brachial artery, the foot, dorsalis pedis and posterior tibial artery, the abdomen it is abdominal aorta. Next question. Is clotrimazole cream safe to use during pregnancy? The options are yes, it is safe and can be used without any concerns. No, it should be avoided during pregnancy due to potential risks. It is safe in some trimesters but not in others. Safety during pregnancy has not been established. So here the correct answer is option A, that is it is safe and can be used without any concern. So this clotrimazole, which is an antifungal drug, clotrimazole topical has been assigned to pregnancy category B by the FDA. Systemic absorption is minimal following topical or vaginal administration, so hence it is safe during pregnancy and can be used without any concerns. Question number 85. A pregnant patient who has a history of schizophrenia was admitted to the hospital for her delivery. As she developed a slight arterial hypertension, she was given methyl dopa 250 mg BID, while the psychiatrist treated her with haloperidol 2 mg BID. After several days, she became progressively irritable, aggressive and was unmanageable. Although the dose of haloperidol was increased to 24 mg per day, this state of permanent restlessness did not subside. So what could be the possible reason? The options are due to the adverse effects of methyl dopa, drug interaction between haloperidol and methyl dopa, patient does not respond to therapy, both A and B. So here methyl dopa is an antihypertensive drug of choice in pregnancy. So here the correct answer is option B, that is due to the drug interaction between haloperidol and methyl dopa. The combined use of haloperidol and the blood pressure lowering medication methyl dopa can increase the risk of extrapyramidal side effects relating to motor control and other central nervous system effects. Both methyl dopa and haloperidol can increase the risk of hypotension also. Dementia occurred when methyl dopa was combined with haloperidol. So the state of permanent restlessness of this particular patient was due to the drug interaction between haloperidol and methyl dopa. So with this question, we have completed today's recall session. Let's see in the upcoming session. Have a good day.